the standard of care for over the past 40 years, I'd say up until about 10 years ago, the standard of care was for the operable patient. The patient was fit for surgery to go in and do what we could. But with these 4 trials that have been done and the guidelines that have come out, I think now neoadjuvant chemotherapy is within standard of care. There's still criticism of these trials. The overall survival in some of these trials isn't as good as has been reported in big case series of primary debulking. Things like the operative time was shorter, and so looking at those, the survival wasn't as good, the operating time was shorter. Criticism, maybe the surgery wasn't as good. Those studies were picked apart in that way. I don't think anybody is saying that means that these studies are not valid. Not at all. I think those are criticisms, and there's some validity to what's being said. But the trials stand as phase 3 trials, and they were well done. And I think that we have to look at them and say this is overall good data. But backing up and saying, well, so maybe if we can pick the patients out, that we can go in up front and do that good operation, we should still listen to those criticisms and say, okay, it's a selection process, that we got to figure out. The controversy is probably going to continue. There probably will be more trials underway. There is another trial underway. I don't think that trial is going to settle the controversy. It's called the TRUST trial.